Are you ready to do this?
Oh, absolutely.
Okay.
Sure.
All right. All right. So 5, 4, 3, 2, and 1. All right, folks, welcome back to the Trauma Therapist Podcast. I am very excited to have as my guest today, Dr. Jeffrey Rutstein. Jeffrey, welcome.
Thank you. I'm glad to be here.
All right. So Dr. Rutstein is a clinical psychologist, an expert in the treatment of trauma, a certified Hakomi Mindfulness-Centered Somatic psychotherapist, and a meditation teacher who's been in private practice for over 36 years. He has practiced meditation for over 54 years, and that profoundly impacts every aspect of his work. He's devoted his professional life to helping people reduce their suffering and struggle while empowering them to claim their strengths, their talents, and their unique abilities to live a more fulfilling and rich life. All right, Jeffrey, welcome. So before we get going here, share with our listeners where you're from originally and where you are currently, and then we'll get going.
So I was born right outside the DC area in Maryland and grew up there until graduate school. And I came up to New Jersey for graduate school, and I haven't left.
Okay. Okay. I don't know if you know, but I'm originally from the East Coast and have definitely lived in New Jersey. So
Oh,
I
wow.
love talking to people who are on the East Coast because it makes me feel like, I'm still there. You can't leave it. I mean, once you're born there, you can't leave it. But
Very true.
anyway, um, so let's start out here. I'm really excited. I mean, you've been doing this for a long time. You have a really interesting background. How did you get into this field?
Well, I knew from a young age that I wanted to do service. I wasn't sure what. Um, and I had thought about either trying to be a veterinarian, a physician, or a psychologist. And uh, I went on a road trip in 1976 with a very good friend of mine, and we traveled around for 6 months, just camping and bumming around. And I really was trying to like sort of search my soul at this young age. Like, what am I going to do for the rest of my life? I guess I was like 21 or something, 22, and it really landed on me. Like I was really ready to do something, and I was most intrigued by the way that people's own minds create their suffering.
Mm.
And I felt that that would be something that I'd like to devote myself to understanding how people get stuck and troubled in their own mind. So that's how I became interested in the field. 1985, I'm treating a woman, and we're I'm seeing her several times a week.
So at this point, you're what, a psychologist?
I'm a
Okay.
psychologist. It's not, yeah, it's 1985. I graduated, I think, in 83. In 85, I have this patient who's been referred to me by her physician. And while we're working, she just gets worse and worse and worse. And everything I'm doing seems to result in a suicidal crisis for her. She
Mm.
jumped out of windows. She set herself on fire. She drove into a tree. She
Wow.
took multiple overdoses. So this was a classic. The term back then was called a negative therapeutic effect, that for some reason doing traditional therapy destabilized her. Um, and that's actually, well, so she presented as very depressed and very removed and had a hard time with eye contact and fidgeted a lot and very flat affect, didn't have, spoke in a monotone the whole time. And one day she came in dressed entirely differently in a halter top, in hot pants and clogs, and was very interactive and talkative and comfortable and giving eye contact. And I didn't really know what to make of this, but I knew that it was important. And that's that started me going down a rabbit hole, where I realized that she was, with the help of my supervisor at the time, that she was likely multiple personality disorder. That's what it was called back then. Now it's called dissociative identity disorder. And I had been trying to treat what I thought was loss and grief and
Mm.
anger issues, and had totally missed the centrality of the trauma, and how once someone's been significantly traumatized, it truly changes their nervous system. So the therapies that we use with people who are traumatized need to be trauma informed at the very least. But that was when I realized that this was an underrepresented population at the time. We had believed that trauma only really occurs episodically with wars. Our
Mm-hmm.
soldiers return home and they have shell shock or battle fatigue, and then we sort of forget it again. And the 80s were when we began to first sort of see the legacy of childhood abuse and the prevalence of it. And that, along with um, I guess this experience with how much it felt like I missed with this woman, and it was only by the grace of God that she survived long enough for me to know
Wow.
how to
Wow.
better treat her. Um, and then, yeah, I was able to, I think, do a much better job. And after that, she wasn't hospitalized again. Once I made the adjustments within treatment,
Mm-hmm.
um, that stopped that desperate need to stop her pain.
Wow. What a story. I mean, thank you for for sharing that. A couple of things here. You talked about that road trip you took when you were around 21, trying to decide between being a veterinarian, a physician, and a psychologist, very different paths. But what was it, Jeffrey, that led you down that path where you wanted to, talked about figuring out people's how their mind was responsible for the suffering. What was it about that intrigued you, that compelled you?
um, I think it was a confluence of several things. I think one thing is that I was no stranger to pain or anxiety growing up, and so um, I knew how my own anxiety and um, the tenacity of my self-judgmental and
Mm-hmm.
shaming and guilting thoughts impacted me. Um, and it was only around this time, by the way, that I started to look back and say, oh, I guess my childhood had some abuse and some trauma in it too. I hadn't really considered that, as many trauma survivors do, just because it's so normalized for childhood abuse to take place in a household, and it's not looked at as abusive, it's looked at as discipline. Um, so consciously, I was intrigued with um, let me back up even more. Okay. So, like, I'm 3 or 4 years old and I'm laying on my back and I am looking at the sky and I am watching clouds. And I remember that this was an activity that I would do day after day after day in the spring, in the summer, in the fall. And there were these experiences that I had where I knew that I was a part of something much larger. It wasn't necessarily personal. I didn't have a concept of God or any philosophical concepts, but there was some place in the way of viewing the clouds and watching the clouds on my back that everything became connected. And what I saw over my life is that when I went through periods of more anxiety or more struggle, I became more disconnected both from myself, but also from any sense of the larger world. It was removed more from me. So I had been working with that for years. Uh, there weren't many medications for kids in those days, and I was really highly anxious. That's how my symptoms appeared. So sorry. So I started seeing a psychiatrist for therapy when I was 10. And after going to them for about a year, twice a week, um, they were helping, but it wasn't enough. I was still being devoured by my anxiety, and I saw a book on my parents' shelf called Yoga for Americans. And I pulled that down. And the first chapter talked about she had these aunts that she was coming into her house, and she had been the first Western woman to take sannyasa Swami vows. And she said to the ants, look, I'm going to put sugar outside every day for you if you leave my place. If you don't, I'm going to have the exterminator come in. And she tells the story of she put sugar cubes outside and the ants never came back into her place again. And to my 10 or 11-year-old brain, she was a shaman. I thought she had all the power in the universe. And so whatever she was going to tell me to do in the next pages or chapters, I was absolutely going to do them without any questions at all. And so I started doing pranayama, breath exercises to deal with my own anxiety. And that sort of also became like a kind of a parallel quest in me. It was both searching for being able to feel connected to this larger context, to God or the universe, and at the same time might not be so riddled and hijacked by anxiety or doubt or shame. So that was already a big piece of my own personal interior work. And I think around my 20s, I was really interested in the joining of um, how can increasing awareness help people heal,
Mm.
right? And one of the things that people of severe trauma suffer from is a fragmentation of awareness, or at least the experience of the fragmentation of awareness. Um, and that's very disruptive for feeling whole or integrated or present.
Thank you for sharing that. Um, so going back to the woman who was kind of that tipping point for you, of becoming aware of the importance of trauma, what did you do to what did you treatments did you seek out? What kind of education in terms of being trauma informed did you seek out?
A great question. There was very little then. The International Society for the Study of Trauma and Dissociation emerged on the scene in 1988. It just began to emerge. I joined a chapter locally that we formed. But before that time, I read all the journal articles and all the books that were written on trauma and treatment, which at that time was probably maybe 20 books,
Mm.
and maybe um, in the decade of the 70s and 80s, maybe 9 articles written on trauma. There were more periodically, again, after wars, but they were 20, 30 years old, a lot of those. So it was kind of easy in the day, and it was very different than it is now. So
Mhm.
um, I was trained as a psychoanalyst. A lot of the early people who wrote were psychoanalysts because that was the dominant training at the time. And they were incorporating a methodology like hypnosis to help people access memory or cut off affect and so forth. We found over time that that would be helpful, but it could also be disruptive, that there was ways that you could help people connect without having to use hypnosis.
Mm.
And more and more, especially the last 20, 25 years, we've seen how much of trauma really impacts the brain and the nervous system directly. And that some of the real struggles, the embodied pain and struggles of our clients, are not going to be accessed by talk alone. So I started studying in the early 2000s, I started studying neurofeedback. And I also decided to get training in somatic psychotherapy. I've been trained as an analyst and several other methodologies as well, but none of them had been body based.
Mm-hmm.
And it was clear to me that either working directly with the nervous system, like in neurofeedback, or working directly with the soma, the body, were going to be the only ways we could help people really sort of dive beneath. Like I could help a lot of patients with talk therapy get an understanding of what's going on, but when they're triggered, talk therapy doesn't give them much to be able to deal with. So, with somatic psychotherapy, that was the emphasis on really helping people understand the body's participation in, or actually in even not only participating, but driving a lot of these
Mm.
reactions and helping people sort of learn how to free themselves of that.
Wow. Is that when you started studying Hakomi?
Yes, yes.
Okay. I've interviewed several people who've uh, studied Hakomi on here, and there's a commonality that I've been able to see, and it's a warmth, and you have that too. Um, can you just give us a little kind of thumbnail of what Hakomi is for our listeners?
Yeah, so Hakomi um, began as a school of psychotherapeutic thought in the 70s by Ron Kurtz, who is not an officially trained therapist, but I think he was an engineer and a keen observer, very intuitive. Um, and it works, again, it's a somatic approach to working with the body, listening very carefully, both to the words being said, but also what the body is communicating in breathing patterns, facial tics, the ways the shoulders move or are held, and all these ways of approaching this. So Hakomi is a deep training. It's at least when I took it, it was a 2-year training.
Mm.
And every month or 6 weeks, you get together for 4 consecutive days of training. So it's very in depth. One of the things that Hakomi works on, like any good therapy, though, is really working on your own blocks to being able to show up for other people. And different about Hakomi than about most other therapeutic approaches is that there's an encouragement for the therapist to embody 5 principles, one of which is loving presence. The idea about being able to both touch into that quality in yourself and stay anchored and connected with that when you're interacting with someone else. What we know, of course, from more recent research is that by embodying yourself in presence and in a warm and attentive position, way of relating with the person, helps the other person feel safe and heard. And if we step back to trauma for a second, one of the really important things with working on trauma is helping create a felt sense of safety for our clients. You can tell someone, you're totally safe in my office, right? Now, a heavily traumatized person will go, you have no idea, dude.
Right.
You know, something could come right through the window. This place could go up in flames. Do not tell me that we're safe. We're not safe. So words don't do it in a lot of ways. But if you're coming from a very grounded and present place, and Hakomi helps you get more skilled in that, and also helping join in someone in their state and help them move through their state, it's a great way of working, I think, in generally with anybody, because it helps get to core material quickly.
Mm-hmm.
But as one foundation of as a therapist, being able to bring that into therapy was immeasurable. I also took sensory motor training, did a bunch of those trainings, and that is basically started by Pat Ogden, who also was one of the original Hakomi thinkers, along with Ron Kurtz. And I took the sensory motor and I liked it, but I'm glad that I took Hakomi first, because Hakomi is much more about being in the body, spends much more time anchoring the therapist in their own experience. Sensory motor taught much more about what you could do in terms of techniques with clients, patients, but not so much attention on monitoring and how to flex with one's own state. Does that make sense?
Yeah, it does. Thank you so much for sharing that. So you are, in case you don't know, doing a 9-month training with Sounds True. Correct me if I'm wrong here. It's called the Healing Trauma Certificate Program, correct?
Yes,
Okay.
correct.
Now, I want to talk about that, but before we get there, Jeffrey, can you share an early clinical error and what you learned from it? I mean, obviously you've been doing this for a long time. You have such a rich background. I'd love to hear get a glimpse of what your arc has been like, what your experiential learning arc has been like.
Well, I'll tell you that, like, one of my most memorable clinical errors is with that first woman I was working with who had MPD. I totally missed it.
Mm.
And I'm sitting there doing what I think is good therapy, and I'm watching her get closer and closer to death. And I'm thinking, this is not what I signed up for. I signed up to help people, not make them feel bad. And not that she's doing therapy so I can feel better, but the idea is that I was feeling horrible as a therapist because, terrible anxiety about what if she does die? I mean, what does that say about me that I mistreated her or I didn't see something? I mean, it felt shaming and scary. And also, like, once it became clear to me what it was, then everything made sense since the first day that I saw her. But until I arrived at that painful place, I wasn't able to see the theme. I wasn't able to see what was linking it together. One of the great things about that was that it taught me a couple of things. Like, before I was able to correctly diagnose her, I start seeing her more and more often because she was getting less and less stable. So for a while, I was seeing her 7 days a week.
Wow.
And if need be, I would be returning a phone call on any day. And I had a beeper. back in those days. And so I would get beeped at night and I would return her calls. She was struggling. Once I got a handle on what was actually happening and what I needed to do to sort of help bring some safety and some structure to what we were doing that would help her feel more held in this place and more supported appropriately. I was able to see her 2 or 3 times a week. Emergency calls basically faded away. And like I said, hospitalization stopped.
Mm.
So like, and to me, this, we're both sort of sharing this. This is what's different about trauma. If someone's just depressed or just anxious, they may have a negative therapeutic effect if you did something wrong in one session or you did something off. But when you're kind of doing things basically as you've been taught, they just don't happen to be suited to the person in front of you. And trauma is the biggest case. When I was going through school, no one mentioned trauma. There was nothing in a book written about trauma that we had to read. There was nothing in my supervisory sessions. So to me, I think the biggest learning from that is always checking when you're interviewing someone about their awareness or exposure to either trauma in their own lives or to have witnessed something traumatic or scary close at hand. Because a lot of people will say, I wasn't traumatized, but my dad beat the crap out of my mom.
Right.
Well, that's trauma.
Yeah. Wow. Thank you. Thank you. Okay. So this course, share with us who it's for, and it's a long, 9 months is definitely a long time. And let's kind of give us a snapshot of what it is, if you would.
Sure. So let me take 1 second to just talk about why it got created in the first place.
Great.
I was talking with Tammy Simon, the founder and publisher of Sounds True, last year, and was telling her that I was concerned that there was going to be a tsunami of trauma patients after we climb our way out of this year of the pandemic, or 2 years or 4 years, whatever it's going to be, and the divisiveness and everything else. And I felt that people need to be given skills to handle the disruptions we're all going to be facing at this time. Because I don't think there's as many people who aren't being affected by some wave of stress, dislocation, and at certain levels, clearly trauma. So this course, we wanted it to be a truly transformative course. So the subtitle of this is how to regulate your nervous system, embody safety, and be a healing presence. So all of trauma therapy and brain research has sort of pointed the direction that excitation lives in our nervous systems and bodies. This, on some level, right, this course applies to anyone who has the human nervous system. And then this especially applies to people who have had some trauma in their lives, close or far, and would like to be able to learn how to work with their nervous system and how to really do enough practice to get familiar with the tools for how do you shift state? How do you go from hyperactive to your window of tolerance? How do you go from shutdown to coming back into connection and contact? How can we be and emit these signals of safety? Because what's happening to all of us in this world right now is we're in a soup of stress. And as mammals, we're great at picking up signals of danger or safety, but with so many people in this world worried, stressed, frightened, angry, despairing right now, that the signals given out to all of us amplify our own doubts, our own anxieties, our own insecurities and worries. It makes us less able to be present and more burdened. Once one can learn how to embody safety for themselves, it is immensely grounding and helpful because you're less likely to get rocked by what's going on around you. And to become or be a healing presence is sort of being able to be in regulation and be able to come and show up with some loving presence. The ability to sort of listen to and be open to someone else we care about, whether it's a spouse or a subordinate, And this is, of course, we thought in our mind for any healthcare professionals, any therapists who were interested in this, for augmenting their own skills, frontline workers, Cub Scout den leaders, um, teachers, educators of all stripes, community activists, coaches, massage therapists, yoga teachers, because we are all going to be encountering the fallout of trauma and identifying what trauma is, its impact on the nervous system. And while there be concepts in this 9-month program, the whole reason we're making it this long is also to really give people a chance to live in these experiences and get support while they do them, so that these become a part of their toolbox. And we have 13, 14 acclaimed leaders in trauma, research, clinicians, who will be speaking to these aspects of the centrality of trauma, the way that all of us have this natural inborn system of fight, flight, freeze, shut down, and that a first step towards healing ourselves is knowing what state we're in. And a second is actually having the tools to do something about it instead of trying to argue ourselves out of it. Wow. Because like whatever we resist persists, right?
So that's a very kind of exciting, I guess, goal for the course, is to first of all, work with people or make people aware of their trauma, but also to work towards becoming a healing presence as well. That sounds pretty exciting to me. I'm just looking at the website now. I see Gabor Mate, Risma Menachem on there. Peter Levine, I believe, is also on there.
Yes, Deb Dana.
Deb Dana. So is each month going to be kind of like a different module?
Yes.
Okay.
Yes. So each month is going to be a different module, loosely broken into trimesters. First trimester is trauma in the body and self-regulation. And each month, each module will be given a series of anywhere from 2 to 4 practices to practice during that module. We're asking people to practice about 10 minutes a day, at least 4 times a week.
Okay. And this is online? All online?
This will be all online, and it's blended learning. So most of it will be asynchronous, so people can do it anytime they want. And everything will be recorded, so if you can't make any of the live sessions, you'll be able to catch up with it. But about 60% of it, 70% of it will be watch anytime you want. 20 to 30% will be an opportunity to gather together as a group and either do questions or actually go deeper in whatever we're covering that module in terms of what's also happening currently in the world. So each month we have a different teacher or two, and we take a different emphasis of that. So first trimester is trauma in the body, regulating the self. Second trimester is regulating self and other. And third trimester is healing the world. It's about dealing with collective and intergenerational trauma, which also impacts all of us, and sort of learning how to untangle ourselves from some of those legacies, and also learning how bringing in a regulated self can also help with more systemic kinds of issues.
Just remind everyone that I'm speaking with Dr. Jeffrey Rutstein. We're talking right now about the Healing Trauma Certificate Program through Sounds True. When does this program start?
So the start, I think it opens up, the platform opens up on the 24th of January.
Okay.
And our opening gathering, I believe, is on the 31st of January. Maybe it's the Saturday if that's not the right date. And then it'll run contiguously for the next 9 months after that.
Okay. And I'll have this linked up here at the show notes page at the traumatherapistpodcast.com. Of course, you can go to soundstrue.com to find out about that. So in addition to this, are you currently seeing clients as well? In what capacity are you working now?
I still have my practice.
Okay.
So I do that, and I do this with Sounds True.
Okay. And you see individual clients, group situation?
Currently only see individuals, and I'm only doing telehealth.
Okay.
But yeah, right now individuals, and mostly individuals with trauma. It's been my practice now for 36 years, is mostly trauma. And people who've been stuck. I think there's two types of groups I work really well with from trauma: people who've also been on a path of meditation or spirituality and gotten incredibly frustrated that they can't make any progress or can't meditate or be present, and trauma interferes with that tremendously.
Mm.
With other folks who've also been through some therapy and feel like they have an understanding, but they're totally stuck still and repeating, um, or not able to get out of that loop of still being driven by the past.
For the listeners, as we kind of wind down here, for the listeners, there's so many trauma modalities out there, trauma treatment modalities out there. You've studied different modalities, but for those people out there who are listening to this who are wondering, how do you decide which one to study? Should I get certified in EMDR or sensory motor psychotherapy or SCI, or what would you say to them?
So the first thing I think is a basic truth, that it's most important that you're a good therapist, that you're a basically good therapist, that you're kind, you're conscientious, that you know your own stuff, that you've been in therapy at some point in your own life, so that you have an awareness of the places you get caught, some of your projections, because it's really important, if you're a trauma therapist, to own your own stuff. Because otherwise it'll be creating a lot of unsafety with the other person in the room, because they're going to know you're angry and you're going to deny that you're angry, and they're going to not feel safe. I'm not angry. What makes you think I'm angry? And they're going to hightail it out of there. So you have to be honest. So the first thing is just put emphasis on learning the basic foundations of basically good therapy. And then I'm trained in EMDR, I'm trained in thought field therapy. I use those very, very, very little.
Mm.
But I very frequently incorporate at this point in time a good deal of somatic understandings. So the two best training programs currently that we have for trauma-informed therapy is somatic experiencing, started and led by Peter Levine, and sensory motor psychotherapy, started by Pat Ogden. These are good ways of learning, but again, they're not going to teach you how to be a good therapist.
Mm-hmm.
Now, if you want to go for a longer course, I highly recommend also Hakomi. Again, Hakomi won't teach you absolute basic skills in therapy, but it will help you a whole lot in learning about intelligently and intentionally using your therapeutic presence in ways that really support the easeful unfolding of your patient.
Mm. Awesome. Love it. Love it. Awesome response. I appreciate that.
Sure.
All right. So as we kind of wind down here, how about a go-to book recommendation, whether trauma related or not? I mean, it could be meditation related or whatever.
So there's a book that I think a lot of therapists should check out, and it's called The Stranger in the Mirror by Marlene Steinberg. She was someone who helped develop the structured clinical interview for dissociative disorders back in the 90s. And her book breaks down the 5 aspects of dissociation: amnesia, identity confusion, identity alteration, depersonalization, and derealization. And the book gives examples of each of these and quizzes, because if someone's been traumatized enough to be highly dissociative, it's actually hard to access the trauma, because if you ask the patient if they've had trauma, they may say to you, no, I don't think I ever have. And they don't have any access to it. But if you're also able to pick up dissociative signs, it helps you know that what you both may be kind of interested in understanding more is hidden.
Mm.
And then you need to not only be trauma informed, but it's helpful to be trauma and dissociation informed.
Mm.
So a good book to learn a little bit about how these dissociative aspects show up is The Stranger in a Mirror. It's a great, great reference.
Awesome. Okay, we'll have that linked up at the show notes page here again. All right, Jeffrey, what's the best way for people to get in contact with you?
If they wish to shoot me well, actually, the best way probably is on my website, drjeffreyrutstein.com, and there's an email link right there, and That's probably the best and easiest way. People still do call, but I answer emails much faster than calls.
Okay. We'll have that linked up. Jeffrey, it's great meeting you. And I want to thank you so much for just sharing openly your story and your experience. It's been great.
Well, thank you, Guy. This was a pleasure. It was a lot of fun for me.
All right. Take care.
All right. You too now. Bye-bye.